Good morning, Mainlanders. Welcome to Mainland 98.3 FM, your trusted source for information and education. My name is Sage Babalola. You're listening to Health Plus on Mainland FM. Basically, what we do is provide you health insight and discussions, and I am your host, and today we're going to be talking about a rather important topic on Health Plus today. I know today we're diving into a very important topic, like I said, that affects millions of men worldwide. From now till 10:30, we'll be talking about prostate cancer, and it is the second most common cancer among men, and understanding it is very crucial for early detection, effective treatment, amongst other things. Now, Nigeria, for example, has seen a very sharp increase in prostate cancer across the world, and it's making it one of the leading cancers among men. And we have studies that sort of suggest that prostate cancer is the most common cancer among Nigerian men. Research even further indicates that about 1 in 5 men will be diagnosed with prostate cancer in their lifetime. It is somewhat significant percentage of cancer-related deaths in the country. So today, throughout the program, we would explore what prostate cancer is, who it affects, the risk factors, the symptoms to watch out for, amongst other things. And let's not forget the importance of support for these individuals as well. But I'm hoping that our doctor would be able to shed more light on all of these pointers that I earlier stated. Well, for the conversation today on prostate cancer, I do have Dr. Mohammed Yakub Habibu. He's the Chief Clinical Coordinator at the NSIA Lute Cancer Center, and he joins us this morning for the conversation. Good morning, sir. Thank you for being here. Hello? Hello? Okay, maybe we would try to reconnect with the doctor so we can get straight into this conversation and at least attempt to maximize the time that we have for the program. It's Mainland 98.3 FM. The program is Health Plus, and we are talking about prostate cancer, a health condition that is somewhat specific to men. Yes, good morning. We can hear you now. Welcome, sir.
Yeah, thank you.
Yes. All right, let's get into it. Talk to us about prostate cancer. If you were to explain this condition to the average person, in what ways would you do so?
Okay. Prostate cancer is a cancer that originates from prostate gland. The prostate gland is a walnut-shaped gland that is at the base of the bladder. The bladder is that organ that houses the urine, and it is through the bladder that the urine passes through the urethra to get out of the body in May to the penis. So the prostate gland is primarily responsible for reproduction, and it includes another fluid that helps sperm to remain viable.
Doctor, I'm really sorry. Yes. It's very difficult for us to hear you. The connection is not very nice. So would you like us to call you back, or do you think you could maybe change your position a little bit?
Okay. No problem.
Okay, let's call you back then. I really apologize for this. This is one of the things that scare me the most about virtual interviews. You never know what the connection would say, and especially on the day where we're trying to maximize time, it is painful that this is happening. But not to worry, we'll do the best we can to educate us on the most significant parts, from the cause, the signs and the symptoms, the complications, the treatment and the management, and also the support available for men who suffer from the condition of prostate cancer. Hello, Dr. Yakub.
Yeah, good morning. I can hear you. Is it better?
This is way better. Thank you. Go ahead, please.
Yeah, so like I said, prostate gland is a gland that is responsible for secretion that makes us the semen, and the secretion also helps to make the sperm viable. The prostate gland is located at the neck of the urinary bladder. Urinary bladder is the sac that collects urine and passes it out through the urethra, which passes out through the penis. So the cancer of the prostate is a cancer that originates from that gland called prostate gland, which is walnut-shaped. And like I said earlier, as you grow older as a man, because the prostate is only found in men, as you grow older as a man, especially when you are above 40 years of age, the prostate gland gets to enlarge. So as it enlarges, it can develop into cancer. As a matter of fact, it has been said that 80% of men that are age 80 has prostate cancer. However, prostate cancer is a type of cancer usually that is low grade. What I mean by that is that it's not an aggressive cancer in most times. It's only about 20% of prostate cancer that is aggressive. And this one that is aggressive is the one that causes symptoms of urination, that's painful urination, inability to pass urine, we will call urinary retention, bloody urination, we call hematuria, and all the other signs and symptoms of prostate cancer.
Well, talk to us about those signs and symptoms. What are the earliest indication that a man might be suffering from prostate cancer?
Okay, the signs and symptoms include frequency of urination, because the prostate cancer usually will cause compression of the urethra. So it will cause obstruction of the urine. So the bladder will get filled most of the time. And when we pass urine, there will be incomplete emptying of the bladder. So we call it frequency. And then that can also result in painful urination, because you'll be forcing the urine through the urethra, which we call dysuria or painful urination. And cancer can invade the cells around it. That is, it can invade into the urethra, into the bladder, and this we call blood to flow into the urine. So the person may start passing urine, what we call hematuria, that bloody urination. If it is not attended to, it can even cause spread to the bone, backbone usually, so causing the back pain. It could cause kidney failure by causing obstruction and feedback to the kidney. And usually, it's not only prostate cancer that have these symptoms. It could be a symptoms of benign prostatic hypertrophy, which also means enlargement of the prostate. And it could also be a symptoms of infection of the prostate, what we call prostatitis. However, for early diagnosis, at age of 40, we start doing screening, which we can do easily by taking the blood and searching for PSA. So when the PSA level is high, or when there's symptoms, any of these symptoms are earlier mentioned, then we'll do further investigation to know if it is cancerous, if it is prostate cancer.
What are the risk factors, the factors that increase the susceptibility of a man to suffer from prostate cancer?
Okay, being a man makes you susceptible to prostate cancer because it's only men that have it. Then, as you go older as a man, the risk of having prostate cancer increases. Like I said earlier, as from 40, we start to see incidence of prostate cancer in most cases. It is very rare before 40. So as you go older, the chances of having prostate cancer as a man increases. When you are up to 80 years, you have 80% chance of having prostate cancer, because 80% of men at 80 years have prostate cancer. However, also, we have some family that have high incidence of prostate cancer. In such family, you may hear that the father had prostate cancer, the grandfather had prostate cancer, the senior brother had prostate cancer, or even junior at times. Uncle has prostate cancer, cousin has prostate cancer. Then the chances of prostate cancer in that family for a man increases. And we have some genetic abnormalities that can also predispose to prostate cancer. For example, there is something called BRCA gene. BRCA2 gene can result in high incidence of prostate cancer. There are other factors like lead from many syndromes, some syndromes that can increase the risk of prostate cancer. Living well, especially doing exercise, may reduce prostate cancer. Apart from that, other factors that may play a role are not well established.
If you're just joining the program, this is Health Plus on Mainland 98.3 FM. We're here talking about prostate cancer, a cancer that is very prevalent in men. And I do have Dr. Mohammed Yakub Habibu here, virtually rather. He's the Chief Clinical Coordinator at the NSRA Lute Cancer Center. We're trying to make sense of what prostate cancer in itself is, the risk factors, the signs, and the symptoms, among other things. So as we progress with the conversation, let's talk about